Well, Joan Rivers at age 81 is dead. And she didn't die from natural causes or chronic infirmity. She died at the hands of a doctor or doctors in New York City, I believe. And she was given a throat operation, and she was killed with the same drug that wound up killing Michael Jackson, propofol. And they used it as a hypnotic, analgesic, pain reliever, something to kind of knock her out a little bit. And she went in for a simple procedure of the throat. At her age, she was probably not a good candidate for the procedure, certainly not in an office setting, in a kind of a storefront office, actually, and didn't end well, as you could expect. Well, let me tell you, she's one out of 15,000, one out of 15,000 seniors over the age of 65 who are killed each month by medical doctors who send them into hospitals for screening tests or minor medical procedures. We're looking at Andy Rooney, the longtime host of the 60 Minutes, sort of that curmudgeon thing at the end for 5 minutes where he picked a subject and ranted and raved on it. 92 years old. He was killed by, quote, complications of a minor medical procedure, unquote. Well, wasn't minor for him. It killed him. They gave him a colonoscopic exam, which he did not need. They talked him into it, and he should have yelled no, no, no at him. And they killed him. They killed Dick Clark with a prostate procedure that didn't need to be done. All he had to do was get on some of our herbs, okay, to get rid of his problem. A prostate is a very simple thing to deal with. And then, of course, they killed Neil Armstrong, our top astronaut, 82 years old, with an elective cardiovascular procedure, which he didn't need. And there was no investigation on any of them by the hospital staff, by the city, county, or state from where these things happen. And Joan Rivers is going to fall into the same pile, except I think her family is going to chase after these doctors because the doctors killing her has kind of cut off their income stream. So I think they're going to go after the doctors and say, hey, if you killed our mom, at least you have to pay us something because otherwise we're going to starve to death, right? Well, I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. So as you get older, you don't need to use these guys. Now, a couple of months ago, I turned 75. I have not been to a doctor, with me being the patient, for 68 years. I've never been on prescription medication. I've been taking the 90 essential nutrients twice a day for 68 years. You think about that. The only piece of paper in my health record, other than my eyeglasses prescription, is my birth certificate. Now, if everybody in America were like me, the medical system would be real humble, wouldn't they? You only go to see them once every 75 years, or once every 75 years. Why should you need them? Well, I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Learn how to take care of yourself. Why should the American public have to take care of themselves when we have what everybody considers some of the best doctors in the world? Well, we don't have the best doctors in the world. We have the most expensive doctors in the world, which translates to, they cost a lot of money, but are they the best? The answer, yes, they cost a lot of money, but they're not the best. We are in trouble when it comes to these doctors. Right now, experts are saying that our kids are not going to live as long as us. For the first time, our kids will be the first generation who don't live as long as their parents. You're going to be burying them. Do you understand that? According to the Institute of Medicine, the Journal of the American Medical Association, and the Center for Disease Control, a federal agency that tracks this stuff, this statistic came out, front page story, USA Today, February 5th, 2007. Each year in America, medical doctors kill, injure, and infect 15 million Americans in their workplace, hospitals, and clinics. Each year in America, medical doctors kill, injure, and infect 15 million people in their workplace. We're talking about hospitals and clinics, all kinds of places where they do this stuff, clinics and hospitals and maybe operating theaters and radiology labs and so on. And so I urge you, don't let these losses of our very famous seniors. Remember, seniors, they kill 15,000 a month. That's 180,000 a year from simple screening tests or minor medical procedures. This is an awful record, And so why would you send mama to the doctor when you can fix her yourself for a couple of bucks a day? You can actually do your own test. Get a hold of the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to go to your pharmacy without a prescription and get all the same test strips your doctor will use in a $2,000 physical once a year, You can do the same thing. You'll pay less than $5 for all the test strips. He uses about $1.50 a piece for your blood test, your urine test, and also a colonoscopic exam equivalent with a occult blood test or a FIT test, which is an acronym for fecal immunochemical test. You do all this for less than $5 total. Keep a logbook at home. Why would you want you have prediabetes on your record? Why you can't get promotions? Your insurance rates might go up. All that kind of stuff. Why would you want to have all that on your record when you can take care of yourself? And again, I'm not stupid, so I do my own physicals like 4 times a year. Okay, every time our family gets together for Christmas and Thanksgiving and 4th of July and Easter and birthdays and anniversaries and so forth, everybody gets a physical. Why don't you do the same thing? By saving yourself, saving your family, saving your loved ones, your church mates, your workmates, you're going to save America. Right now we're in trouble because we've turned it over to the doctors and they have failed us terribly. Remember, only dead doctors don't lie. We'll be back with Dead Doctors Don't Lie, more Truth, Justice, and the Young Judy Way after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, this goes with what you were discussing in your monologue, and that is doctors making mistakes. This is a Washington Post story headlined, "When your surgeon accidentally leaves something inside of you." They say removing a wrong kidney is something that happens, but most harmful thing that surgeons can do is leave material inside of you that doesn't belong there. They call it retained surgical items. Can cause a bit of harm beyond pain and suffering, readmission, additional surgeries, abscesses, intestinal fistulas, obstructions, visceral perforations, and even death. And studies estimate that it happens about once in every 5,500 to 7,000 surgeries. There were 51.4 million inpatient surgery procedures performed in 2010, according to the National Center for Health Statistics. They say that there's new authors on a new study. They estimate that the typical hospital has 2 of these incidents per year. That's like every hospital in America. So if you go to the hospital, you're running the risk of being one of those 2. They say each mistake is costly. In 2007, Centers for Medicare and Medicaid Services estimated the average price of removing one of these items at $63,631 per hospital stay, and larger settlements in lawsuits can run from $2 million to $5 million. And a new study, though, published in the Journal of the American College of Surgeons, says that item left behind is usually a surgical sponge, a 2-inch by 2-inch gauze, or larger squares of gauze that are used to sop up blood. Authors say technology offers a way to reduce the number of times this happens. Traditionally, nurses keep track of the sponges by counting them. Before and after the surgery, sponges can be hard to locate when they're tucked away and soaked in blood. The most common places they're left are the abdomen, pelvis, thoracic cavity, and the vagina. They say there are much more able to hold bacteria than a needle or a drill, which are the other 2 commonly left in items. The sponges are often lost during emergency surgeries where there's little time to thoroughly count them. They say in the past they used x-rays and barcodes that help detect the lost material. And the study identified radio frequency detection systems as the best and most cost-effective way to keep track of sponges. The gauze has a tiny chip sewn in a pocket, and in the operating room, personnel can use a wand at the end of the procedure to detect if there was a sponge left inside. And what I didn't realize, Doc, was that even though they know that they've got one missing, the surgeon often goes ahead and closes the surgery site, even though their count was wrong. They say they looked at 824 reports of sponges remaining inside the patient. They found that the majority of them, 525, were left intentionally by surgeons for medical reasons. 45 were unintentional. Of those, 28 were discovered after the surgeon had closed the surgical cavity. 9 were discovered after the patient had left the OR. And there were 4 that were found in patients that were discharged and had to come back. So nearly half the cases, the surgeon continued to close the incision despite noting that before and after sponge counts did not match. That's crazy.
It is crazy. And of course, that last possibly where they just released a patient, it was a lady Marine and faithful service to this country, retired as a Marine after 20 years. She went in for oral surgery, and the oral surgeon didn't even count the sponges. And she kept complaining about pain in her chest, and they took x-rays, and they didn't have any of the barcodes or chips in this sponge. And she started coughing up blood at the hospital. and she hemorrhaged to death because the sponge they had left or had allowed her to swallow during the procedure had actually abraded the lining of the esophagus, and she hemorrhaged to death. Here's a Marine survived 20 years of service as a U.S. Marine for the United States, killed by an neurosurgeon and a lethal weapon called a surgical sponge, which is really, really tragic stuff. And, of course, this is part of the 22 mistakes that each surgeon does per surgery. Per surgery, 22 mistakes per surgery, leaving stuff behind. They know that in many cases when they leave stuff behind, because they got an appointment, they got to get to the golf course or the tennis court, and they don't want to be late, and so they just sew people up because 99% of the time when they leave stuff in, it doesn't cause a problem, just extra baggage. It only causes a problem when it causes a problem. Well, thank you, Doug, for bringing that one to light, and we'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Tulsa, Oklahoma, and Victoria. You're on with Dr. Wallach.
Hello, Victoria. You're on the air.
Well, hello, Dr. Wallach. I heard you the last time you were here on the 25th of August.
Okay.
And the time you were here before. I'm a new distributor as of that date, and I have someone I'm trying to help, and his concerns are carpal tunnel, sleep apnea, and he has respiratory problems. He works in an environment where he breathes paint and other horrible things. He's about 180 pounds and 61 years old. What would you recommend that he take?
Okay. Well, first of all, you work in an environment full of dust and fumes and stuff. He should wear some kind of approved mask. I mean, these should be made available by the employer, certainly. And there's all kinds of these masks available to keep particulate and gaseous matter, out of your respiratory system. So he should wear the proper equipment. Okay. When you say he has respiratory problems, we're talking about COPD. We're talking about asthma. What are we talking about here?
I don't know. He just said he has respiratory problems. He didn't go into detail.
Obviously, Victoria, if he smokes, he's got to stop smoking. None of the bad stuff, no fried foods, no processed meats, no oils, no gluten. And Shar?
Yes?
What would you do for a guy with, connective tissue problems, joint problems, like carpal tunnel syndrome, 180 pounds? Also remember that this guy has respiratory problems. What would you do for him?
I would give him 2 of the healthy bone and joint packs.
Okay, perfect. And what would you do for his respiratory problems?
For his respiratory problems, let's see. There's a lot of things we could give him. One thing he could take is the Oxybody. That would help his breathing.
Absolutely, increase his oxygen level in his blood.
Yep.
Also, what would you do for somebody with asthma? What would you give him?
For asthma, I give him the EFAs.
Well, there you go. Well, he's with the healthy bone and joint packs. 2 of them, he's going to wind up with 3 of the EFA pluses per day. And so you're exactly right. I would go ahead and add 3 of the EFAs a day in addition to the 3 EFA pluses, and that'll be 2 bottles a month. And sleep apnea, Victoria, is a normal behavior. Doctors have turned it into a disease, but it's a normal behavior. People stop breathing when they sleep based on their carbon dioxide levels in their blood. And it comes down to, if you're a person that just lays there and doesn't move when you sleep, you produce less carbon dioxide, and you're likely to have a stoppage of your breathing for, say, a minute or 2 until the carbon dioxide builds up, which will cause you to breathe again. And it's absolutely criminal, I believe, that doctors have turned a normal, natural behavior into a disease just to be able to sell a CPAP machine, do surgeries, and sell you some drugs. Absolutely criminal. And so let us know how this guy's doing. This stuff is certainly easily manageable. And insomnia, you give them the 90 cents. Don't forget to throw in the Sleepies, 3 of those at bedtime with a glass of water. We'll be back after these messages.
Let's head to Florida. And Marcia, you're on with Dr. Wallach.
Marcia, you're on the air.
Yes, doctor. Yes. I have a problem with my heart and my colon. Can you give me for that?
Okay, what's the matter with your heart?
They say they're going to go I don't want to say they're going to a procedure, but I don't want to take that procedure.
Okay, they're going to put like little stents in? They're going to do bypass surgeries or work on your valves? What are they going to do?
Something like that.
Something like that, huh? Okay. All right. And you weigh how much?
105.
105?
130.
Okay, 130. Okay. 130. Okay. All right. Char, what would you do for this lady who has heart problems? And Marcia, are you on any medication?
No, the only aspirin they give me right now.
Okay, that's it. Okay. So she's got diabetes, type 2 diabetes. She's got colon problems. And on your colon problems, Marcia, have you been diagnosed with like irritable bowel syndrome or diverticulitis or diarrhea or colitis? What?
No, I just have constipation. Sometimes I can't use the toilet.
Okay, constipation. Okay, here you go, Shar. Constipation. She's 130 pounds. 130 pounds. She got type 2 diabetes, high blood pressure, and heart problems. What would you do for her?
Okay, I would give her one of the healthy blood sugar pack, and then I would add selenium to that. And if she needs, because of the colon problems, I would say she's got to get on a gluten-free diet. And she could take, the root beer belly and stuff to help in the meantime.
Okay. And very, very good. Let's see here. What would you do for the high blood pressure?
Okay, for the high blood pressure, she's going to get, she can take the Ultimate Daily, but she's going to get calcium anyway with the healthy blood sugar pack, but she needs to add the Ultimate Daily for the high blood pressure.
Yeah, very good. Excellent. Okay, so Marcia Shar is exactly right. One healthy brain and heart pack per month. Get the extra bottle of selenium so you can have, she said healthy blood sugar pack. That's right. So one healthy blood sugar pack. I'd actually get an extra bottle of the Sweeties. You take 3 of those twice a day. Be sure you're checking your fasting blood sugar before you medicate yourself. 1 ounce of the Osteovex Plus a day, a half ounce at breakfast, half ounce at dinner. 1 scoop of the BTT, Beyond Tangerine 2.0 at breakfast and dinner. The 3 EFA Pluses, I would take 1 at breakfast, 1 at lunch, 1 at dinner. I'd also get the Ultimate Daily tablets, as Shar said. I would take 3 twice a day as 1 bottle a month. That will support heart health, as well as blood pressure, and support healthy blood pressure and support healthy blood flow through obstructed arteries. And that's the Ultimate Daily. And I think she's exactly right. The root beer belly for the constipation. And then give us a call every couple of weeks. Let us know how you're doing. Gluten-free diet. Don't forget gluten-free diet.
Let's head to Oregon. And Pat, you're on with Dr. Wallach.
Hello, Pat. You're on the air.
Hi, thank you. I just learned about you about 3 weeks ago, and we started on the Tangy Tangerine. I have a cataract in one eye, and I'm about 130 pounds. So I was taking 3 scoops twice daily, and it seemed to improve. And then when I got my next shipment, I had some selenium and FX because I have a little arthritis in my hands. And I started taking that, the selenium. It was like taking 2 pills 3 times daily. I did this for a couple of days, and I noticed my vision was worse in the one eye. And so I quit that and just kept taking the Tangy Tangerine. And so that's my first question. What am I doing wrong, or what do I need to improve? What do I need to do?
Okay.
And my second question...
Whoa, one question at a time here. One question at a time. Okay, so don't get everything mixed up. Now, how much do you weigh again? I got to go back to how much you weigh.
I weigh 130.
Okay, 130. Okay. Anything's possible, okay? When you start mixing 245 nutrients together, or, we got 115 fruits and vegetables, anything's possible. You may have a sensitivity to one or the other. The question is, when you stopped taking the selenium, did you see a benefit?
No. Stayed about this. It might have gotten a little better. I'm not sure. It seems to me that it's about the same.
The same, okay. And so, do you know to what degree your original cataract had reduced your vision? We're talking about 3%, 10%, 25%. What did the eye doctors say?
Oh, no, it's really bad. What would I say?
How old are you?
I can't see far distance, and I can't read with it very well.
Are you wearing glasses?
No, my other eye is fine.
Okay, how old are you?
I'm going to be 65.
Okay, all right. What I would do is I would go ahead and make sure you're avoiding all the bad stuff. It's the bad stuff that actually causes cataracts. The bad stuff includes fried foods. I mean, nothing fried. I don't care if it's stir-fried organic vegetables with extra virgin olive oil and coconut oil. no frying, no oils, no olive oil, no coconut oil, no margarine, mayonnaise, salad dressings, cooking oils. If you're eating canned fish, it's got to be packed in water, mustard, tomato sauce, not oil. And absolutely no gluten, no wheat, barley, rye, and oats to maximize absorption. And at 130 pounds, I would go ahead and continue to take the Beyond Tangerine. Did you get the Healthy Start Packs, as sort of the basic program where you got the Osteo, the Beyond Tangerine, and the EFA Pluses?
No, I didn't get that.
What did you get?
I wasn't sure what to do, so we started with the Tangy Tangerine.
Okay. All right. And so basically there's a couple of pieces missing. I'd go ahead and get the basic, I'd kind of ramp up a little bit and get the Healthy Brain and Heart Pack, because the eye is the brain is the eye. And I'd get an extra bottle of selenium so you could have 3 twice a day. Okay, I want you to take 3 twice a day. And this is to give you some protection against free radicals, because things are going to, no matter how diligent you are, there's going to be some sneak through in your food and things, because you go to a restaurant, you forget, tell them about croutons in the salad, you forget to tell them, even if you pick them out, there's already dust on your salad. And then you forget salad dressings, how they cook, the temperatures on meat and so forth, all very important here. And then, of course, the 1 scoop of the Beyond Tangerine at breakfast and dinner, and the 3 EFA Pluses in the morning and the 3 EFAs in the evening. All would be accomplished by the 1 Healthy Brain and Heart Pack a month and the extra bottle of selenium. Then I would get the Vision FX. The Vision FX, I go ahead and take 3 of those twice a day. That'll be 2 bottles a month. But it's imperative to do both. Okay, Pat, you want to stay away from the bad stuff. Again, no fried foods, no processed meats with nitrates and nitrites, no oils and no gluten. I really keep your sugar down. Wouldn't hurt to do your own blood sugar test, see what that's looking like. Be sure when you take these things that are the powders particularly, or the other liquids, the OsteoX Plus, the Beyond Tangerine, you want to put them in water as opposed to juices. I don't like a lot of sugar. Bananas are probably okay compared to, say, grapes and peaches. I'd stay away from the grapes and peaches and eat, banana to help you with bowel movements, get a little bit of natural fiber. And next time you go to the doctor, I want you to let us know what he says about that cataract that's in there, because to catch it in the early enough stage, cataracts are reversible. As sort of the middle stage of a cataract's sort of progression, you can prevent it from going forward, but it's almost impossible to reverse it. In the final stages, where you really get advanced cataract, it becomes a surgical case if you want to do something about it. But usually it's in one eye. It's better just to wear glasses and do the nutritional thing for your good eye. And just remember, you're not going to have binocular vision, maybe even lose some 3D stuff because you're using one eye instead of 2. But I would go that direction. Some people like to improve their seeing, and of course I'd consult 2 or 3 different eye doctors and get some opinion whether or not you'll get benefit or what percentage benefit you can expect from surgery on that cataract. Okay? And give us a call next. You go to the eye doctor and let us know what's going on. All right, Doug, let's go to callers.
Let's head to Virginia. And Sandra, you're on with Dr. Wallach.
Well, Sandra, you're on the air.
Hello, Dr. Wallach. A former student of mine had recommended that I call you, and I've been dealing with something called Ehlers-Danlos syndrome. It's a connective tissue disorder, and I was exposed to a lot of toxic mold. A lot of things happened after I was exposed as a professor to toxic mold. I do the gluten-free. I'm on a low histamine diet, organic, but I'm having life-threatening breathing things happening, and
like what?
Haven't
you have,
been able to.
You have COPD symptoms. You have asthma symptoms. What do you got?
Sometimes it's asthma. Sometimes I've heard it described with this Ehlers-Danlos, that's the rare genetic thing, that sometimes it's just like a vice around your chest where you can't breathe, and it happened in the doctor's office the other day.
We only got a few minutes here, so let me ask you a couple of quick questions. Do you have any children?
No, I don't.
Okay. Did you ever have miscarriages, or just never pregnant?
I'm sorry, what?
Did you have miscarriages, or were you never pregnant?
I was never pregnant. My sisters and my mother had a lot of miscarriages.
Okay.
So
And then
I was the first one to make it through.
okay. Then what about your sisters? Do they have children? Hello, do your sisters have children?
Yes, they have daughters.
Okay, well, hang on. We'll be back. I'll ask you a couple more questions, and Sharon and I will give you the answer. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young's 89 for Life Crusade. And Doug, let's go right back to Virginia and Sandra. Okay, Sandra, your sisters, you say they have daughters?
Yes.
Okay, and do any of them have asthma or skin problems, eczema, dermatitis? Any of them have bowel problems? Or
Not that I know of. I have a redheaded complexion, or I'm a redhead, and one of my nieces is a redhead, and our skin seems to be, more sensitive to things. Now, something that is happening, and I was diagnosed with hypersensitivity pneumonitis. That it's almost like, I guess that it's like instant pneumonia after the mold exposure.
Yeah. Okay, we got to go quicker here because we've only got a moment. So if you get your pen and paper out, okay. Well, first of all, the Ehlers-Danlos syndrome is not genetic. It seems generational because your mom has passed on gluten intolerance to you and your sisters to your children, their children. There were several miscarriages from your mom. That goes along again with a gluten intolerance. She couldn't absorb enough to maintain pregnancies. Not infertile, she couldn't maintain pregnancy, couldn't absorb stuff. And so everybody's got to get gluten-free. You got to get gluten-free. Your mom's got to do that if she's still alive. All your sisters, all their children. If you have brothers in there, they've got to get on a gluten-free diet. But they're not going to pass it on, but you want to take care of them, add time to their life. Everybody's got to get on the 90 essential nutrients appropriate for body weight. And the gluten-free diet, of course, would include, you got to look at the contents of dog food, cat food, bird food, fish food. Everybody living in the house, spouse, mother-in-law, whoever, has got to be gluten-free. And then, of course, the 90 essential nutrients appropriate for body weight. And, of course, the reason is I would go with the healthy brain. I'd go with the healthy brain and heart pack 1 per 100 pounds of body weight, and then add an extra bottle of selenium because you need the copper that's in our selenium product to help with the elastic fibers in the blood vessels in the skin. And I would also get a hold of what we call hair, skin, and nails. Get the hair, skin, and nails. Take 3 of those twice a day per 100 pounds of body weight. I'd also get what we call bone builder. It'll help build collagen in the blood vessels, the skin, the bones, the joints, the tendons, the ligaments. Take 3 of those twice a day per 100 pounds of body weight. And then I think your sort of chronic lung problems will go away, whether it's pneumonitis, whether it's asthma, bronchitis, whatever you call it, chronic colds, easy pneumonia, that sort of stuff, is also due to a deficiency secondary to gluten intolerance, so that should go away kind of thing. But give us a call every couple of weeks to let us know how you're doing, kind of monitor all these different categories of problems you have. Anytime you go to the doctor and you get another report, for better, for worse, staying the same, give us a call, give us an update so we know how to tweak things if we have to. But I think you follow this program and get on the diet, you and your sisters and mom, if she's still alive, will do very well. But there's a classic picture of a gluten intolerance and multiple nutritional deficiencies. Not genetic in any way, shape, or form, but then doctors are ignorant and only dead doctors don't lie. So how much time we got here, Doug?
About 60 seconds.
60 seconds. Shar, you got a 30-second answer for people?
Well, yeah. Again, people need to take care of themselves. Like, you only care about your body yourself more than the doctor does. He only wants you when you're sick because that's the way he makes money. So if you take care of yourself, you'll never get sick. You'll never have to go to him. Do preventative maintenance. Take the Healthy Body, Healthy Start Pack. Everybody needs to be taking the Healthy Start Pack.
Yeah. Now, Shar, how long has it been since you've been to a doctor with you being sick?
Oh, it's been over 25 years. I stay away from them because they would try to get me on prescriptions, and I'm not going to take them.
And you're how old now?
I'm 71, going on 72.
You're 71, going on 18.
Yeah, mentally, yep.
Okay, very good. And you've been taking the 90 for how long?
almost 25 years now. Every
Yeah.
day.
Very, very good. Well, we're very proud of you, and of course, you are a great teacher. You teach a lot of people, and I can't thank you enough for all the great things you do with the Longevity Organization and for America, for that matter. So thank you, Shar, and thank you so much, Doug and Richard, for a superlative job today. God bless each and every one of you. Great testimonies, great questions today. God bless our troops. God bless our Navy SEALs, and God bless America.